Hi everyone, let's today talk about cardiology, dermatology, hematology, and leeches. No, I'm just kidding. We're going to go ahead and get into Unit 7 where we're going to talk about the anaerobic gram-positive rods that do not have spores. That would be things like your actinomyces. And then we're also going to talk about the anaerobic gram-negative organisms. So let's go ahead and get started. Okay everyone, this is Unit 7. The first topic I want to address is the anaerobic gram-positive rods without spores. If you recall from the last lecture, the anaerobic gram-positive rods with spores is things like Clostridium species. But today we're going to talk about the anaerobic gram-positive rods without spores. And those would include organisms such as actinomyces, Lactobacillum, which the old name for that is Eubacterium. You might want to write that down. Cutibacterium, the old name was Propionibacterium, anaerobic lactobacillus, and anaerobic dipteroids. These are all anaerobic gram-positive rods that do not have spores. Some of the most interesting gram stains are those of gram-positive rods that are anaerobes without spores. For example, lactobacillus is a long, slender gram-positive rod in chains. It looks very similar to lactobacillus, that's an anaerobe. We also have anaerobic dipteroids, which are palisading gram-positive rods. Those could also be described as Chinese letters. We have branching gram-positive rods, and that would include organisms such as actinomyces. Bifurcated gram-positive rod, that would be Bifidobacterium, and Bifidobacterium causes pediatric otitis media. Bifidobacterium often looks like a dog bone when it's stained. And then we have our slightly bent gram-positive rods. These are often described as boomerangs. The name for this is Cutibacterium acnes. The old name was Propionibacterium acnes, but they're not really branching, they're more bendy like a boomerang. The best way to identify these anaerobic gram-positive rods without spores is to start by doing a gram stain. That gram stain morphology is going to lead us in the correct direction. And then after we've done the gram stain, that morphology is going to reveal whether or not we need to do a catalase, a nitrate reduction test, indol, esculin hydrolysis, or carbohydrate fermentation tests, such as fermentation of lactose, glucose, mannitol, and arabinose. Now, Cutibacterium acnes is catalase positive and indol positive, and actinomyces is catalase negative. But usually we do a combination of these tests in order to identify these gram-positive rods without spores. Actinomyces species is the cause of actinomycosis in humans. Actinomycosis often leads to lesions of the face, neck, mouth, or jaw following dental extraction, lung and sinus abscesses, peritonitis, brain and heart valve infections. Some significant species of actinomyces would include Actinomyces israelii and Actinomyces odontolyticus. Actinomyces israelii is most frequently the one that is encountered, and they are associated with sulfur granules. This is a granular object usually seen by pathologists or histologists in tissues that looks like elemental sulfur. The actinomyces are thin branching gram-positive rods, and macroscopically they may resemble a molar tooth colony. They actually look like a molar tooth sticking in the auger. This usually does require a 5-day anaerobic plate for growth. We set up an anaerobe plate if we're looking for actinomyces, and we leave it undisturbed for 5 days. I'll show you a picture of what a branching beaded gram-positive looks like in the next slide. So if you take a look at these images here, you can see that actinomyces is a branching gram-positive rod, and you can see that nicely in the top two images on the left and on the right. On the bottom left is what we call a beaded or fungus-like bacteria. It's a beaded branching gram-positive rod, and that could be an actinomyces or it could be something more like a nocardia. And then actinomyces has a macroscopic appearance that often looks like a molar tooth colony, and you can see that bottom image on the right looks like a molar tooth actually stuck in the agar media. This here is an image of a sulfur granule associated with actinomyces infections, and again it's generally the pathologist or histologist that's going to see this on the slide. Sulfur granules are not actually sulfur, but they resemble elemental sulfur. Well, it looks like this slide got away from me a little bit. I need to change Eubacterium to the new name, which is Lacno-anaerobaculum. Lacno-anaerobaculum. That's a hard one to say, but that's the new name for Eubacterium. I do want to talk a little bit about the miscellaneous gram-positive rods without spores, including lacto-anaerobaculum and anaerobic dipteroids. Okay, the significance of lacto-anaerobaculum is that it's kind of something that might cause a wound infection, or the significance of this organism is really uncertain. Anaerobic dipteroids, on the other hand, are usually not significant, and they do resemble picket fences or Chinese letters or palisading forms. Let's go ahead and talk about Cutibacterium on the next slide. You can either pronounce this Cutibacterium or Cutibacterium. I've heard it pronounced both ways. I call it Cutibacterium because it's cute. But Cutibacterium acnes, the old name for that is Proprionum bacterium acnes. This is a commonly encountered anaerobe. It's often one that is a contaminant of blood culture bottles. But this is the most common anaerobic non-swarming gram-positive rod. It is normal flora in the upper respiratory tract, the GI tract, and the skin, and it is usually considered a contaminant, especially in blood culture bottles. It is a gram-positive rod with a slightly bent shape due to its snapping phenomenon during binary fission. I often like to say that it resembles a boomerang. They are catalase positive and indole positive, and they were first discovered in Swiss cheese. The fermentative production of CO2 makes the holes in Swiss cheese. So that's kind of interesting factoid about Cutibacterium acnes. Anaerobic lactobacillus is very similar to aerobic lactobacillus. It is part of the normal flora of the upper respiratory tract, the gastrointestinal tract, and the vagina. It is rarely a pathogen. It is almost never speciated. They are catalase negative, and they have that typical lactobacillus gram-same morphology where they have long chaining gram-positive rods, and it may actually have a curlicue on one end. Let me show you a picture of what lactobacillus looks like in the next slide. So lactobacillus can be either aerobic or anaerobic, but it usually looks like long chaining gram-positive rods. They're usually thin-looking gram-positive rods, and like I said, sometimes they can have a little curlicue on the end. Let's talk about the anaerobic gram-negative organisms now, including Veillonella, Acetaminnococcus, and other things like Bacteroides fragilis. So let's go ahead and talk about those organisms now. Some of the anaerobic gram-negative cocci that I want to talk about are Veillonella and Acetaminnococcus. These are actually cocci, and there's not a lot of true cocci that we talk about that are gram-negative in microbiology, but these are anaerobic gram-negative cocci. Veillonella and Acetaminnococcus are both resistant to vancomycin. In fact, generally all gram-negative rods are resistant to vancomycin. Usually your gram-positive organisms are sensitive to vancomycin. Veillonella is a very small gram-negative cocci. It's even smaller than Haemophilus influenza. They inhabit the oral cavity and will reduce nitrates to nitrites, and they will fluoresce brick red with UV light. Acetaminnococcus is a large and coccobacillary organism. They can be in singles or diplococci. They usually live in the large bowel, and biochemically and enzymatically they are pretty inert except for indole, which may be produced. So here's a nice picture of Veillonella. It is a tiny gram-negative cocci. A lot of the times you'll see these in the oral cavity. Some of the anaerobic gram-negative rods would include things like Bacteroides fragilis. This is very common. Bacteroides theta iota micron, Prevotella melangiogenica, Fusobacterium mortiferum, Fusobacterium necrophorum, Fusobacterium nucleatum, and Porphyromonas species. These are often normal flora of the oropharynx, digestive tract, and the genital tract. Bacteroides is normal intestinal, genitourinary, and oral cavity flora. It is the most common anaerobic gram-negative rod. That would be Bacteroides fragilis, of course. That is the most common anaerobic gram-negative rod. It's also the most healthy and grows really well. It's not fastidious by any means. The second most common anaerobic gram-negative rod is Bacteroides theta iota micron. It is a pale, staining, and pleomorphic gram-negative rod. And Bacteroides will also tolerate high amounts of bile salts and high levels of kanamycin. All other anaerobes will not. Okay, and Bacteroides may also be the cause of bacteremia or abdominal abscesses, among other things. Bacteroides is relatively an easy anaerobe to identify. It is one of the few organisms that will tolerate bile salts that's an anaerobe. Okay, it's also going to be resistant to vancomycin and kanamycin, and Bacteroides is the only organism that is resistant to high amounts of kanamycin that is an anaerobic gram-negative rod. It does grow up right up to the bile disc, okay, and it is esculin positive and H2S negative. This will be noted on kanamycin bile esculin media. We will visit this media in lab. It is nitrate reduction negative and will vigorously grow on both low kanamycin vancomycin and kanamycin bile esculin media. The indole test actually differentiates the two species of Bacteroides theta iota micron and Bacteroides fragilis. B fragilis is negative, while B theta iota micron is positive. Other anaerobic gram-negative rods would include Prevotella and Porphyromonas. Prevotella is mostly and moderately saccharolytic, which means it ferments sugars. Porphyromonas, on the other hand, is very similar to Prevotella except for sugar fermentation properties. Porphyromonas is actually asaccharolytic. They are both pigmented. They are both normal flora of the mouth, but also Porphyromonas could be a pathogen of the mouth. Prevotella may cause head, neck, and lower respiratory infections, and they both will fluoresce brick red under UV light. Prevotella can tolerate low amounts of kanamycin, and so can Porphyromonas. In other words, both Prevotella and Porphyromonas are going to grow on LKV, which is low kanamycin vancomycin media. They are resistant to vancomycin, esculin negative, and bile salts positive or negative. They're variable. Neither Prevotella nor Porphyromonas will grow on kanamycin bile esculin agar. They just cannot tolerate high amounts of kanamycin. In most circumstances, Prevotella and Porphyromonas are not speciated, and speciating them is actually quite difficult. They're very similar to each other biochemically. They do have red fluorescing patterns under UV light, and they are darkly pigmented colonies that ferment sugars. Those are your Prevotella species. Red fluorescing dark pigmented colonies that do not ferment sugars are Porphyromonas. It may not be relevant to test the saccharolytic properties of these organisms in all cases. Instead, what we can do is just report out Prevotella/Porphyromonas species, and actually it doesn't really matter too much in most cases because these all used to be Bacteroides anyway. Other anaerobic gram-negative rods would include the Fusobacterium species. Fusiform actually means spindle-like, and many of these Fusobacterium species are needle-like in morphology, but many are not as well. Fusobacterium necrophorum can cause significant pharyngitis in kids that are 15 to 20 years old. Fusobacterium necrophorum are normal flora of the upper respiratory tract, GI tract, and genital tract. They may cause mouth infections, septicemia, and bite wound infections as well. They may be needle-like gram-negative rods, and they are going to be sensitive to kanamycin. They're indole positive, and in this case, they will fluoresce apple green with UV light as opposed to brick red. They are lipase positive on egg yolk agar. Okay? Fusobacterium nucleatum, on the other hand, is normal flora of the upper respiratory tract, the GI tract, and the genital tract. Infections that are caused by Fusobacterium nucleatum would be mouth infections, septicemia, and bite wound infections. And they may also be gram-negative rods that are needle-like, but they may also have a spherical swelling in the middle. So they could have needle-like gram-negative rods with kind of a bulbous area right in the middle. They're indole positive as well, and they may fluoresce apple green as well, but this time they're going to be lipase negative on egg yolk agar. Now, all Fusobacteriums make only butyric acid, while other anaerobic gram-negative rods make butyric acid and isobutyric acid. Here's a nice picture of fusobacterium on the right. You can kind of see that they're thin or delicate looking gram-negative rods that are kind of needle-like on each end. Generally, fusobacteriums are not speciated, and it's usually Fusobacterium nucleatum that is the species isolated from clinical specimens. Most of these are asaccharidic and won't ferment sugars. Now, there's a certain scheme we want to follow in order to identify those anaerobes. Okay, the first thing we want to do is an aerotolerance test. So we're going to take a colony of the organism and plate it on both an aerobic chocolate agar and an anaerobic blood agar plate. We're going to incubate it, and if it only grows on an anaerobic plate, then it is an anaerobe. Okay, then what we want to do is look at the macroscopic morphology. Take a look at the organism's hemolysis and pigment. If it is an anaerobe, stain it. This will determine your next task for identification. You can also fluoresce the organism with UV light. If it's green, it's probably going to be a fusobacterium, and if it's brick red, it could be a Prevotella, a Porphyromonas, or a Violinella. You can also do 15% catalase test on these organisms. You can do a spot indole test because your Cutibacterium acnes will be positive. You can do nitrate reduction. And then also look at the organism's susceptibility to colistin, vancomycin, kanamycin, bile salts, and SPS. Lipase and lecithinase activity will also help you identify some of these gram-negative rods that are fusobacteriums, okay? Now, usually we use lipase and lecithinase activity on gram-positive rods to identify our Clostridium species, but just keep in mind lipase and lecithinase activity might be helpful in the identification of some gram-negatives, such as fusobacterium. Most cultures, except for blood cultures, but all other cultures are only held for 3 days, okay? Now, one thing that we want to do is on the second day, that's when we start to look for anaerobes, but we never want to disturb those anaerobic plates for at least 48 hours. Now, sometimes if the doctor is looking for actinomyces, we will have a 5-day plate set up for actino. We want to examine the anaerobic blood augers plates or brucella plates macroscopically and use your sense of smell because often you're going to smell anaerobes before you actually see them growing on the plate. Brucella agar is very similar to blood agar plate except for it has the addition of hemin and vitamin K, which helps support the growth of anaerobes. Subculture your organisms to aerobic and anaerobic plates to determine aerotolerance, and then gram stain those colonies if they appear to be an anaerobe from your anaerobic plates. Okay? Determine the identification test based on that gram stain. And then finally, I just want to give you some tips on how to identify anaerobes, okay? Gram-positive cocci are almost always called Peptostreptococcus. They are usually very tiny gram-positive cocci that chain, much like an aerobic strep would. It's very rare to encounter Peptococcus because Peptococcus appears dark brown or black pigments and is resistant to SPS. For gram-positive rods, determine if spores or boxcars are present. If there's spores or boxcars present, it could be a Clostridium species. If they're branching or palisading, it could be anything from an actinomyces all the way to a bifidobacterium. If you have Clostridium, you do want to test it for lipase and lecithinase activity. And miscellaneous gram-positive rods should have catalase, spot indole, and nitrate tests performed as well. Cutibacterium acnes is common and is catalase and indole positive. And then for all of our anaerobic gram-negative rods, we want to set up a kanamycin test, colistin test, vancomycin test, nitrate reduction, and bile susceptibility test to identify these organisms. To create the anaerobic environment, we do that very similarly to how we create a capnophilic or microaerophilic environment. We actually take the anaerobic pouch and we place it inside of the anaerobic jar, and what happens is that we add a satchel, and that satchel absorbs oxygen in the jar and generates about 16% of CO2 or more simultaneously and produces anaerobic atmosphere. This usually happens within about 2 hours or so for it to get down to 0% oxygen. Now, one thing that is important with anaerobes is that we always used pre-reduced plates. And what I mean by pre-reduced is we take our plate and we anaerobically reduce it before we place any organisms on those plates. We always want to use an anaerobic indicator satchel that should be colorless and turn pink if oxygen is adequately removed. And that's it for our lecture on Unit 7, which included our non-spore-forming gram-positive rods that are anaerobes, and also our anaerobic gram-negative rods. So stay tuned for Unit 8.